The Health Insurance Portability and Accountability Act of 1996, HIPAA for short, is a federal law that mandates industry-wide standards for healthcare information on electronic billing and other processes and requires the protection and confidential handling of protected health information, also known as PHI. What kind of information is considered PHI? The answer is broad and includes unique types of data which may identify a patient. Information such as email addresses, names, birth dates, device serial numbers, and postal addresses are all considered PHI under HIPAA. HIPAA's privacy regulations require healthcare providers and organizations to develop and follow procedures that ensure the confidentiality and security of PHI when it is transferred, received, handled, or shared. This applies to all forms of PHI, including paper, oral, and electronic. Email and text messages also fall within the scope of HIPAA's protection. HIPAA's reach extends to covered entities and business associates. Covered entities are healthcare providers that electronically bill for services. Typical examples of covered entities include Cochlear's professional customers, such as hospitals and clinics. Medical device companies may also be considered covered entities if they bill federal healthcare programs, such as Medicare or Medicaid, for products that are sold to patients. Cochlear is considered a covered entity. Business associates provide services to covered entities and may come in contact with a covered entity's PHI. Typical examples of business associates include software vendors, marketing agencies, and general service providers. All business associates are required to sign a special contract known as a Business Associate Agreement, which sets forth the rules of how to handle PHI when it is stored, reviewed, or transmitted. PHI may be shared between covered entities and business associates if the purpose is limited to patient treatment, payment, or healthcare operations. Remember the acronym TPO. Treatment means communication of PHI necessary for treatment of the patient and includes order forms sent to Cochlear specifying type of device appropriate for a patient's surgery, a Cochlear sales representative's presence at a surgery to support Cochlear products, a cochlear audiologist reviewing films or patient records to assist with a consultation, and cochlear audiologist on call discussing product performance or troubleshooting with a patient's audiologist. Payment involves the use of PHI in relation to securing payment from insurance providers and includes Cochlear Otologic Management Services, OMS, insurance support, providing support for product reimbursement, and cochlear reimbursement billing Medicare or Medicaid on behalf of recipients for parts and accessories. Healthcare operations means transmission of PHI in connection with an entity's usual business activities for which PHI is necessary and includes maintaining complaints to comply with quality system requirements and auditing reimbursement practices to ensure compliance with applicable laws. Any exchange of PHI that is not limited to the TPO exceptions may be considered a breach of PHI unless the patient has given their written consent for the exchange. A breach is an impermissible use or disclosure of PHI. As a result of the changes to HIPAA in 2013, this type of use or disclosure is presumed to create irreparable harm to the patient unless the covered entity or business associate can prove otherwise. If a breach of PHI has occurred, Cochlear may be required to pay significant financial penalties up to $50,000 for each incident, notify the individual whose information was improperly disclosed, including the media, and the Department of Health and Human Services. All Cochlear employees are required to contact your legal department representative if you think an inadvertent disclosure of PHI has occurred. Best practices for handling PHI include using the minimum necessary descriptors to identify patient information and a careful approach to the transmission of PHI included in emails, faxes, texts, and conversations. Examples of best practices include using patient initials rather than full names when practicable, securing laptops and devices in the trunk of your car, and never using a USB or flash drive to store PHI.